detail. So, what is the general approach for a ABO discrepancy? How do you look at the ABO discrepancy? One is record all the results carefully again. Then start by obtaining fresh sample to rule out contamination. First thing to do. Obtain fresh sample. Do not release a discrepant report unless you get another sample from the same patient. And this time, obtain it separately and not in batch. Repeat the testing. Okay, with fresh antisera. Open a fresh pack of antisera from your lab. Doesn't matter if you use a fresh pack. So you use a fresh pack of antisera. Retest it with fresh pack of antisera after obtaining fresh sample. If there is a suspicion of antibody coated cell, performing DAT, direct antiglobulin test also. So discrepancies are basically divided into four for the sake of understanding. The first is group 1 discrepancy. Group 1 discrepancy related to a missing antibody shown in reverse grouping. Forward is showing something, reverse doesn't match. Reverse grouping does not show antibody, which means antibodies are less in that individual. What scenarios? I already told you the scenarios in which antibodies are less. That is newborn, where the antibody is immature, or an elderly, when the antibodies have declined. Patient in immunosuppression, patient on bone marrow transplant, post chemo patient, patient after plasma exchange transfusion, patient after a very recent plasma exchange transfusion and diluent antibody levels. The patient with weak or negative reverse reaction is what do you do? Now you have an individual where the forward grouping is showing you an A positive, the reverse is not showing any reactivity with B, very weak. What do you do? Then one thing that you can do is take the entire clinical history, look at the age, look at the entire clinical history, ask if there is any chemotherapy, ask if previous plasma transfusion is there, any other blood transfusion is there. Rule out all pre-analytical, analytical, and clinical perspectives that can interfere. Then obtain a fresh sample and then do a prolonged incubation. A prolonged incubation is if you extend the incubation to 30 to 45 minutes at room temperature or 15 to 20 minutes at 4 degrees centigrade. What you also need to do is increase the cell versus serum ratio, increase the cellularity of the sample. Okay, so that also can be done to resolve group 1 discrepancy. Most of the group 1 discrepancies get resolved here, but definitely do not skip investigating or doing a root cause analysis to rule out any pre-analytical or lab-based or technical error before you look at this troubleshooting step. The next is the group 2 discrepancy, where the antigen is missing. We were talking about group 1 in which antibody was missing. Now the group 2 in which antigen is missing. So the group 2 discrepancies, these involve atypical or weak antigens showing an unexpected weak forward grouping and a strong reverse grouping. So this happens usually when the ABO subgroups are seen. So especially when the A2 is seen, or a weak A is seen, or an acquired antigen for A, like A bracket B is seen. So in all these cases, you will see this type of discrepancy, which is type 2 type of discrepancy. So the lab approach is to, again, prolong the incubation, use an anti-B or an anti-A1 lectin reagent also in addition. Perform the absorption elution test because the low number of antigen load can only be detected by absorption elution testing. And then next step is check the saliva secretory status. Make the whole table of detecting weak antigen, which we just discussed some time back. Finish that whole thing. You will be getting your answer.